Hello, Zoe here. I am on today to chat to you a little bit about transgender female gender reassignment surgery, or GRS as it's more commonly known. I had my surgery back in May 2023, and it was an experience to say the least. I was waiting for the surgery for quite a few years. I had a lot of hoops to jump through. I had to have a number of mental health assessments. I had to have consultations with two different doctors, surgeons, multiple consultations with the surgeon who would eventually perform the operation. And it just seemed like a never-ending process. And I think when you're going through that, you kind of feel like, oh, it's never going to happen. It's never going to happen until the day that it did. And I was like, not nervous at all until we got to the hospital. And then my heart was in my chest, like in my throat. I was freaking out, really nervous. And it wasn't that I didn't want to have the surgery. It was that I'd never had any major surgery. I knew, I was very aware of the complications that could potentially happen. Um, but I was constantly thinking, oh gosh, what if this doesn't work? Or what if I bleed too much afterwards? What if I don't wake up from the anesthetic? Like all of these different things. What if I never heal? What if I need to have some further operations to fix things? There were so many factors that were really messing with my mind, and I was just very nervous, very nervous. I did document a lot of it on my Instagram, um, but yeah, there's. I found that I had to try to remain positive. The hospital was very nice. I was met by nurses who I'm trying to think now, who settled me into my room, gave me all the gowns and things, and told me roughly what would be happening. And then, a short while later, the surgeon came and had a quick chat with me. His bedside manner isn't particularly great, but he does his job, and that's all you can ask for from a surgeon. You could be the nicest possible surgeon, but if your work is not particularly good, then you're stuck with that forever. Um, and I had one night, basically, I had a meal, and then I had to change into the gowns and things, um, and eventually get to sleep. The morning of my surgery, I was one of the first in. I think I was seen at about some point between 6:30 and 7:30 in the morning or something. Uh, I was so spaced out. I had no idea what was going on because they came in to wake me up. And when I wake up, it takes me a good hour before I'm like fully functioning. And I always need a shower. Um, so thankfully, they gave me a little bit of time to have a quick shower. Did they? I think they did. Or did I have it the night before? I can't remember. I forget that. But regardless, um, they gave me my pillow and told me to carry it. And maybe it's a comfort thing. Maybe it's just, I don't know. They walked me through the hospital to the surgical area just outside the operating room. And I was laid down. I had an anaesthetist and the surgeon both chatting to me about different things. One was sticking something in one arm, one was sticking something in another arm. Um, and they're just chatting to me, and I'm like so spaced out. I was, what's going on? um, and then before I knew it, I was out. Like the next thing I remember was waking up, like being bundled into my room. Um, I couldn't feel a lot. I wasn't in any pain. I had no idea what was going on. Um, but I managed to get my phone so I could call my mum. Apparently, I made no sense whatsoever, which is funny. There we go. And then, yeah, I had a handful of days, like maybe 4 days, at the hospital whilst they checked on wounds. I had to have a bag for my urine. Um, and then they were encouraging me to go for number two, and that was not a pleasant experience. I was in a lot of discomfort because I'd been laying down for so long and I hadn't been to the toilet that way for a day or so. But yeah, honestly, wow, it was kind of good in a way to get the feeling of getting it out. However, I felt like all of my insides were going to come out. It was not a fun experience. Um, as time progressed, the catheter was removed and I started to have to use the toilet normally, I guess. Um, and bandages were removed and given pads and things. Everything was a mess and so swollen down there. It was so uncomfortable. I could not sit. I couldn't sit properly for close to 2 months. It was a very complicated time for me. However, the body heals as long as you take care of it, you eat the right foods, and you stay clean and healthy, then you can, get to where you need to be. I had some small issues with granulation tissue, which is where the wounds like heal a bit differently. It's like a cell overgrowth essentially. Um, so it was causing some minor bleeding internally for a while. But I continued with the dilation, which is an experience. 3 times a day, first of all, then down to 2 times a day, then once a day, and then every other day. And I think I'm on about every third or fourth day at the moment, something like twice a week maybe. So it's less inhibiting to my time doing day-to-day things, which is good. I don't have to think about it that often anymore. I don't have to have everything out on the side of the bed ready to do it every morning. Um, so I feel like I'm kind of getting my life back, which is really nice. Um, and yeah, I think in about a month, I go down to once a week dilating, which would be fine. It's not ideal. In an ideal world, I would never have had to have the surgery, but I did need to have the surgery. And I'm so glad I did. So glad I did. I've had some countless checkups where I'm told how good a job it is, which is that a compliment to me or is that a compliment to the surgeon? I don't know. It's some form of compliment, I suppose. And yeah, it's nice. It's everything works how it should work. Everything feels right. It feels like it's always supposed to have been that way. Um, so I guess any advice I could give is try to stay calm, have patience whilst you recover, because you can feel so swollen and sore at times and just so alien. You've had major surgery is enough, let alone a body part changing. Um, but just be calm, be patient, and things will work out. If this is something that you want to do, discuss it with many people, friends, family, doctors, consultants, surgeons, and just enjoy the ride. Because yeah, it's it's an experience, uh, but a very very good ending. So yeah, that's it for me for now. If you've got any questions, don't forget to send me a message or whatever. Or put them in the comments, and I will see what I can do. And yeah, thank you so much. I will see you on the next one. Bye.